And we can speak now to Dr. Giacomo Grasselli. He's an anesthesiologist from the University of Milan. He's coordinating the network of intensive care units in Lombardy. Dr. Grasselli, we know you're very busy at the moment. Thank you for joining us here on DW. Can you give us an idea of what the situation is in hospitals right now in Lombardy?
Yes, to give you an idea, I can give you just some very simple numbers. Like before this crisis, we had in Lombardy around maximum 800 ICU beds available for people. And since the start of the epidemics, so in the last 20 days, we have admitted to our ICU a total of more than 900 people. Of these, let's say 120 have been discharged, about 90 have died, and the remaining, around 700, are still there. So from these numbers, you can understand how big is the stress on the system. So we've been able to increase our ICU beds capacity by about 50%, something like that, with a huge effort of everyone. We have reorganized our hospital network in order to centralize the time-dependent diseases like, for example, trauma, stroke, only in few hubs, and to free space to have new units dedicated. We have created a network of specialized COVID-19 units in several hospitals. And so until now, we've been able to cope with this incredible amount of patients in a very short, limited period of time. But, you know, Lombardy is a very rich and modern region. It's already one of the richest region in Europe. And still, we're really struggling to deal with this incredible, as I say, tsunami of patients who is investing us.
Yeah, we've heard reports of nurses, of doctors working around the clock, working past capacity to be able to treat enough people. We've also heard reports of nurses, healthcare officials having to reach almost impossible decisions of deciding, because there are so many sick people at the moment to treat, who to treat and who they cannot. Is that true? And who is reaching that choice?
Well, that's a very important point, and there are a lot of polemics now in Italy. But I want to make this very clear. Well, in everyday's life, an anesthesiologist, when he's called to see a critical patient, has to take a decision whether ICU admission is proportionate for that patient condition. I mean that we admit to the ICU only patients who can benefit from ICU admission and intensive treatments. And if a patient cannot benefit because of a number of factors, which is not only age, of course, but it's age, past illnesses, morbid chronic conditions, and quality of life, and so on. If a patient does not benefit from ICU admission, he will not be admitted to the ICU, no matter how many free beds you have.
Yeah, we understand it's a really difficult situation that you're facing right now. A lot of people are looking to Italy and saying, with more than 10,000 cases, what has happened there? I mean, why has the virus spread so quickly there?
It's very difficult to say. Apparently here in Lombardy, it happened something similar to what happened in Wuhan. Probably the virus was around for has been around for at least 1 month. Unrecognized, and then something happened, like a super spread event, that like started this fire, which is very difficult to turn off. And clearly we're having a huge number of patients, an increasing number of patients. And what's different from at least what was reported from China is that the number of patients in the ICU, because in our case series, at least 10 to 12% of the patient, of the positive patient, need ICU admission, compared to, let's say, less than 5% in the Chinese population. So what I want to make very clear, and what I want to say, to tell everyone in the world, is that the solution for this is not opening new beds, new ICU beds, or keep buying ventilators. This is a solution for people who are already sick. So the only way to avoid that this becomes a disaster, and when I say disaster, I mean hundreds of thousands of deaths. The only way to avoid this is to avoid the spread of this disease. And this can be done with simple behavioral measures.
Yeah. Okay.
So you can increase your ICU bed as much as you can. But again, if you are invested by this tsunami, your ICU beds at a certain point will never be enough, no matter how efficient, modern, and powerful.
So, Dr. Grasselli, just to cut in quickly there, what you're saying there is your message to other countries that are facing what your region is facing right now is, please slow the spread.
First, get ready. So prepare your healthcare workers to the proper use of personal protective equipment, for example. Reorganize or try to think how to organize your ICU network, but most importantly, prepare the population. Tell them that once you have the initial spread, they need to change their behavior. They need to reduce their social life. I mean, in theory, if everyone stays at home for 3 weeks, this is going to end because no new patient should be infected, okay? So I understand it's a big limitation of personal freedom, but otherwise, this is going to be a disaster.
All right, we'll have to leave it there. Dr. Giacomo Grasselli, an anesthesiologist joining us from the University of Milan in Lombardy. Thank you very much.